Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff. Tonight we're joined by Mario Martinez, Assistant Director of San Antonio's Metro Health Department, and this is our COVID-19 update for the San Antonio community. Tonight we're reporting 291 new cases of COVID-19, which brings our total to 43,455. That pushes our 7-day average down slightly to 259 cases per day. Unfortunately, we do have a number of deaths to report tonight, and these are deaths that were investigated between June 12th and August 11th. So we're reporting 26 new deaths tonight. And again, these are those that have been verified and fully investigated. That brings our total to 545 friends, neighbors, loved ones who have been lost to COVID-19 in our community. So let's please keep them and their families in our prayers. On the website, you'll also see 261 cases that are pending investigation, and those are, again, reported by the state, have not been fully verified by Metro Health. Over in our hospitals, tonight we're reporting 710 people in the hospital. That's down 10 from yesterday. We've had 53 new admissions to the hospital, so we're starting to see our admissions levels daily remain stable. 309 are in the ICU and 213 folks on ventilators this evening. 52% of ventilators are available and 15% of our staffed hospital beds are available. Again, the stress level in our hospital system has eased slightly, but it still remains very high. Therefore, Metro Health recommends remote learning at this time. And if you are able to, continue to stay home. And if you're not at home, please wear a mask and maintain physical distancing. Let me move it over to Judge Wolff.
Yeah, thanks, Mayor. You know, all the indications are moving in the right directions, but they're moving fairly slowly. If you look at the fact we're looking at schools starting on September the 8th, we've got roughly about 24 days to get down where we need to be so that we can safely open the schools. So you'll have to work with us, and everybody has to be careful in making sure we do this the right way. And then as we open schools, that we take all the precautions necessary to do that. I did issue another executive order today because mine ran out. It's the only reason I did it today. But we are going to close county parks over the holiday. We'll close it on 11:59 p.m. on Friday, September the 4th, and it'll stay closed till 11:59 p.m. on Monday, September the 7th. The mayor and I, we did that with our parks over July the 4th, and we saw a tremendous improvement over what happened the previous holiday. So leading up to school, we want to make sure we're doing everything we can to make it as safe as we can here, and so that'll be a step forward. We will continue to stop the foreclosure sales. There was one scheduled for September the 1st. We'll keep that policy in line. Not having the foreclosure sale on September the 5th. But so it's pretty much what we've been doing, Mayor, except we wanted to get the parks in there.
Well, thank you, Judge Wolff. And I do want to mention, you know, as we've been seeing the pandemic unfold, not just here locally, but also across the state and across the country, we've now crossed 5 million confirmed cases of COVID-19 in the United States. A full 10% of those cases are here in Texas. So there are quite a bit more cases and several outbreaks in other cities around Texas. And so keep in mind, if you are visiting folks, if you're leaving San Antonio, take extra care as you go to certain places that may be experiencing a continued outbreak. We are certainly not out of the woods here in San Antonio either, but we want to take full precautions as our public health professionals have reminded us. And also, it is worth noting that San Antonio has been doing a good job. If you are continuing to practice your physical distancing, wearing of masks, we thank you for that. The numbers are starting to move in the right direction, as we've said repeatedly. If you have suffered and have now have healed from COVID-19, we do encourage you to consider a blood donation and also a test for antibodies. You can visit southtexasblood.org to see if you are eligible to donate plasma that can save lives for people who are suffering severely from COVID-19. As always, you can get the latest on COVID COVID-19 in our community by texting COSA-GOV to 55000 or visiting our website anytime at covid19.sanantonio.gov. Mario, myself, and the judge are available for questions.
Yeah, I wanted to ask about the 50 UT Health case investigators that started today at the Alamodome. Is Metro Health waiting to use all 200 case investigators that are stipulated under that contract?
So they will be trained, and we will use them as needed. So this week we started the first batch of having new individuals trained, and so they'll be starting to work on case investigations. And then as we move forward, monitoring the number of cases, then we'll be working with UT Health to get additional case investigators ready to help.
So right now it's sort of closed or paused at the 50 that are there now.
At least temporarily, but with the number of staff we have right now from Metro Health, and then also UT Health, and as we're seeing the numbers slightly sort of stabilizing, it does give us indication that we are meeting the need for case investigations and contact tracing.
The second question I had was, will Metro Health allow case investigators eventually to work remotely? Because my understanding is that at this point they're not.
Right. We're still looking into that. We want to make sure that first we're able to transition all of our data and making sure that we're able to then know all the functionalities of the Texas Health Trace system, making sure that as we get new people trained, that they're able to do that, and then we can move and look into to see if that's even a possibility.
Mr. Martinez, with that being said, with many contact tracers and case investigators here working in San Antonio, are they running into any challenges as they do their work?
So, the challenges is basically just understanding the new functions of the new system. And so the training is really helping our staff and the UT Health staff understand sort of the some of the fields that they have to enter. But the experience that they've had before has helped them to really kind of leap in and start making those case investigations go a lot smoother moving forward.
When trying to communicate with people in our community, are they having any challenges trying to reach people at this point, or?
No, so we haven't heard of any challenges. So the contact to the individual remains the same as we've used before. So we're not seeing any different or additional challenges to that.
With the hospitalization numbers going down, and now went from severe to high, what do we credit for this? What is causing the stress level to go down?
So it could be different factors. We have definitely lower number of admissions. We definitely look at the number of tests being performed in our community. As we know, we see fewer number of tests being performed in the last few days. So it's really a combination of different factors that are sort of indicating we're on the right direction, as the judge mentioned earlier. We have lots of our folks in our community that are doing the right things, using their face covering, making sure that they're social distancing, making sure that they're hand washing, and avoiding large crowds. So all these things combined make for the direction that we're currently seeing in our community.
Is that what we're hearing from our hospital leaders?
Yes, I think the indication is that the numbers are where we want them to start going down, and hopefully we can continue to see that track.
Yeah, what we hear from STRAC just about every day is that the numbers are moving in the right direction. They're just not moving very quickly. And so that's why, we continue to urge caution. And even once we get the transmission level down, we want to see the positivity rate obviously below 5% before we really feel like the infection is back under control. Even when we get it down that low, we want to continue to practice the physical distancing and wearing a mask, because it can get out of control very quickly if there's not any vaccine or therapeutics.
I was curious about that, because if we do get to that level where we see the positivity rate where we want, as well as the hospital numbers, do we ever see these restrictions being lifted, or we're just going to continue going this direction or being like this until a vaccine is available?
There's a lot of unknowns with this virus, but we just cannot, get our guard down at any point in the near future So even with the vaccine that we hope to see even at the beginning of the next year, it is still important to make sure that we're using the precautions even at that point. And so we are always learning new things about this virus and making sure that we're conveying that to the community and making sure that at this point we're saying yes, keep using our precautions that are recommended.
Don't forget, we're going to be entering a flu season also, which will lay on top of the COVID. So I think, like Mario said, we're going to be wearing masks and social distancing and sanitizing for quite a bit longer, maybe even after the first year, depending on how we move along with the vaccination.
Do you know if hospitals are at the point where they can operate without the state or DOD help?
I don't know if we've heard anything from STRAC regarding the additional support.
Oh, what was the question? I'm sorry.
Do you know if hospitals are at the point where they can operate without the state or DOD help?
Oh, in terms of the capacity issues?
Since the hospital numbers are getting
Right.
better, do you know if hospitals are at the point where they can function without help from the state or the DOD?
Yeah, those DOD teams that came in July and late June, I guess, or maybe in July, are short term. We're short term, so they left a while ago. So a lot of what you're seeing in terms of the easing of capacity and the severe stress is just by virtue of the caseload starting to come down slowly. But those teams from DOD left after, I think, 7 days. There may still be some state teams deployed. We can find out for sure.
Or it could have been redeployed to other parts of the state that have a higher number of cases and, of course, seeing higher hospital capacity.
In regards to nursing homes, is Metro Health investigating any new nursing homes this week? And do you know if some nursing homes are having trouble receiving COVID-19 test results quickly? I know at some point they were having, it took weeks to get back those tests.
Right. We don't show any additional or new nursing homes on our list, and we have not heard from our team about any challenges regarding testing.
Will Metro Health ever start reporting numbers in schools in much the same way that they are already reporting for other congregate settings such as nursing homes?
So one of the things that Dr. Lewis stated is having districts report numbers on their website. And so as we get that information, that it'll be available for the public.
Have we heard of an update about our local models at all as to what we're predicting or projecting for the month of August?
Great question. So STRAC and Eric Epley, they're on that and expect an update for the test or for the model this week, hopefully before the end of the week, and it will be a model that projects out to September or into late September. So as soon as we get that model, we hope to present it to you.
Any early indications or anything?
Early indications are that we are tracking right on the curve as we showed last, which again showed about a 3-week plateau and a slow decline starting in mid-August, which is where we are now. But it's tracking almost perfectly to the blue line.
This week, the governor spoke about PPE in Texas schools. Is there any information with the city if you all received any PPE from the state to give to schools locally?
I don't know. Are they providing that directly to the schools? I know we got a big warehouse full of PPE. I'm not sure how they're distributing it.
My understanding is that it's going directly to school districts.
Do we have the average number of people getting tested every day right now?
Yeah, so the demand has gone down. So the only concern with the demand going down is we also want to see the positivity rate going down. But today was reported about 2,600 to 4,500, roughly on average. It falls within those two bounds.
And our capacity is what number again?
Is it
7,500.
okay?
When we say the demand has been down, has that been just recently? Can you give us a time frame as to when we've been seeing these numbers go down?
I think we started seeing a decline in individuals getting tested maybe last week. We started seeing sort of the numbers sort of easing or plateauing and then slightly declining. And so we are working to communicate the importance of testing in our community. And so we'll be making sure that we are, working with partners to get that information across, letting folks know about the testing locations, making sure that they can reach out to a healthcare provider about that. So that communication continues and will continue to be and kind of added to all the other methods that we've used previously to make sure that we're making sure that folks understand the importance of testing if they want to get tested and looking at the various locations where people can do that.
It may be hard, but for context, why do you think people aren't showing up to get tested as we were seeing?
I think Dr. Aga maybe mentioned this on Monday. There could be maybe just various reasons why individuals may not get testing. I mean, we see again in our community that their positivity rate is declining, which maybe indicates that they're, just a little bit easing off of the disease in our community. But again, there could be other factors that go with that.
We're running, I have the numbers from yesterday, about 1,000, but I know they've gone down. I don't have the high point, but people coming there have to have a symptom or they won't be tested in our 3 sites. The other sites, I guess they're taking anybody that wants to show up, but in our sites, so it's a real, to me, an indication that less people are getting sick. Look at the hospital numbers. Look at the number of people going to our sites that have to have symptoms before they're tested. So both of those are pretty good indications.
Is there any update on the jail and the situation there?
Well, we're steady. I think by yesterday's count, we had 102 that are still positive in there, and we've been running around 100 for quite some time. As I said, before they started stuffing our jail full of people again, we were running about 20 a day, so we're running, 5 times more on average than we were at our lower level because we have 3,754 people in the jail, and we were down at 2,900 when we really got successful. But, we're still having the same problems with the state, not taking prisoners that should be going to their own Texas prison system. There's still, I think, over 300 of those still left, and then the governor taking away the right of a judge to make a decision in these low-level cases has backed them up. So, that's the reason why things have happened. The state did both those things.
We have a text question from Mariah Medina at Kansas TV for the mayor. Newly released records show 4 San Antonio police officers were fired in July amid allegations of excessive use of force. What is your reaction to this news, especially in light of the social and political climate as it relates to law enforcement?
Yeah, well, looking forward to the briefing with the council, and also if excessive force was used, we hope that the firings will stick. And that's been the challenge, is that the chief has had muted executive authority to get rid of bad officers. And if this was the case, we hope these firings stick and don't get overturned in arbitration.
Thank you.